There are 5 new cases of COVID in Victoria as contact tracers try to find close contacts of a person who was out in the community while working infected with coronavirus. Reporter Drew Jones is in Melbourne. Drew, good morning to you. Where did this person go while infectious?
Yeah, Janie, so just repeating that breaking news, 5 new cases in Victoria today and 2 in hotel quarantine. So the cluster now 35 and 46 total active cases. On to this unfortunate instance. It was the breaking news last night. So this person was in Mill Park, Dandenong, Epping and Reservoir and a few other suburbs as well, worth checking on the Victoria Health website. So there are 20 new high-risk exposure sites after this person was out working at a food distribution centre while infectious with coronavirus. They had no symptoms at the time, subsequently tested positive, and the dates that it's been confirmed that they were infectious are May 18 and 19, and they are still trying to work out some other dates as well. So you can understand a busy night for contact tracers and for Vic Health officials last night, trying to get in contact with any close contacts and for people who have been exposed in these areas, worth getting a test and getting checked that you haven't picked up coronavirus. And certainly there's been a couple of cases now, Janie, where we've heard about people who had symptoms or who were out in the community while they had coronavirus, which is certainly very concerning at the moment. And that's part of the reason why we've got so many people isolating, up to 15,000 close contacts at the moment, and 47,000 tests the day before yesterday, which shows at least that people are serious about getting checked at this stage. Now, some concerning vision also has emerged, Janie, from a pub in Chapel Street where people just 10 minutes before lockdown 4.0 started on Thursday night in very close contact, not wearing masks. It was absolutely packed in there, and Victoria Health reportedly not happy about this, and they are investigating at the moment. So just repeating that news again for you, Janie, 5 new cases linked to the cluster in Victoria today.
And you mentioned the pub last night, but how was the mood this morning as you entered day 2 of lockdown?
Yeah, so unfortunately for all of those small businesses, cafes and restaurants, pubs and bars all around Melbourne who planned for a big weekend rush, they're not going to be able to do that. Some takeaway services available at the moment, plenty of people with coffees out walking this morning, but not much more than that. So it's estimated that $7 billion will be lost out of the economy because of this lockdown over the next 7 days. And while there is a package coming from the Victorian government, at the moment, nothing from the federal government. They've knocked back any sort of assistance. As we know, there's no JobKeeper available at the moment. So there is concern. I mean, I heard Paul DiMartino, who was speaking on Sky News a couple of nights ago, who runs at Lamaro's in South Melbourne, that pub. He was talking about the fact that his staff were in tears because they need that money to pay their rent and to look after their families, and that he was considering paying his staff through the lockdown even though they wouldn't be able to work. And that gives you an idea of the difficult situation that so many people are in at the moment. And we spoke to a few of those people involved in small business.
It's doom or gloom, basically. And if we continue like this and no support, I might as well close the doors now and say goodbye to something that I love.
Well, I try and give them all at least a couple of shifts so they can survive. So that makes them feel a little bit more at ease, but I've got to carry that.
We would love another grant package. We're keeping our fingers crossed that that's what's going to happen.
Janie, so 46 active cases with 5 new today. We'll be hearing from the Victorian government shortly. You'll see it all on Sky News.
All right, thank you very much, Drew Jones.